The initial part. Well, usually the whole process starts when somebody sends an email through the web or calls the office and asks about a procedure that Dr. Steinberg does. We normally then will have a conversation if we're on the phone. If we're not on the phone, I'll send you a detailed email outlining all of the steps about the consultation process, the procedure, what recovery is like, and a quote for cost as well. Yeah, so once you get the email through email or on the phone, we're going to communicate. We're going to find a time for you to come in and meet with Dr. Steinberg. I will meet with you myself as well. I meet with all new patients when they come into the office for Dr. Steinberg. We're going to spend a good part of the time together. What we are going to do together, you and I, as a patient, is really focus on what your goals are. What is the end result of the procedure? What is that supposed to be? That's really the most important part. So we're going to start with the end and work our way backwards. So you and I together will meet, we'll talk about it. I'll give you all the detailed information about what the procedure could be. You and I will do an assessment, so we'll look at the body, we'll go head down, top down, and talk about all of the particular areas that bother you. I'll talk to you about what the procedures would be, what's involved in having them done, and then also what the recovery is like. Once I get an idea of the direction we're going in, then I'll go out and I'll get Dr. Steinberg, and then he'll join us for the conversation, and then you'll have your time with him as well. Sure, of course. That's why we're here. We're here to make sure that you're coming into the consult as well informed as you possibly can be. So whether it's me directly or I have a great staff here, Abby and Joshua, everybody knows the answers to most questions that patients ask, and we're definitely able to, chat on the phone or have an email conversation. Yeah, some patients do it beforehand because they want to know that they're approved for a certain dollar amount. Others do it while we're here in the office, and others do it after the consult is over. We're not going to know the exact cost of a procedure until we do the assessment and we write down all of the procedure details. So part of what we do during the assessment, you and I as the patient, we're going to create a map of all of the areas that we're going to talk about. And this one is a map. So this becomes the surgical roadmap. This lets us know everything that we're going to do, highlighted in different colors. So pink is liposuction, green is body banking or fat transfer, blue are implants. So we will create a map for you. This way, when Dr. Steinberg joins us, he knows exactly what we're talking about. This also goes all the way into the OR with you. So on the procedure day, this is hung up in the OR or it's posted on a big screen, and this way we're always referencing what we spoke about at the initial consultation. In aesthetics, probably 18 plus years. Yeah, 8 years with Dr. Steinberg. Yeah, so basically we do the map, or I do the map with the patient together. Once I know what we're talking about, and then I'll update Dr. Steinberg. This paper goes, as I mentioned, goes all the way through to the end of the surgery. So Dr. Steinberg will know by looking at this and obviously by me telling him what it is that we discussed. He'll come into the room, he'll do his own assessment. It's not just me, obviously, it's the doctor. Usually we're pretty much we pretty much agree or in alignment on what we're doing. And then this map comes up again at a person's pre-op appointment. A pre-op is an appointment that we schedule in advance of a surgery date. So it's an appointment in between the consultation and the actual procedure date. So then we can go over all of the do's and don'ts of what to do before surgery, what not to do before surgery, and again, review the whole process with Dr. Steinberg. Well, normally it varies from where we are. If we're in New York City, anyone over 60 is required to get a medical clearance. Anyone under 60 who is healthy has to have basic blood work done. Obviously, if there's a medical condition that we are concerned about, safety is always number one. So we may ask for a medical clearance beforehand. In LA, in our LA office, the The age is a lot lower. So anyone over 45 needs medical clearance. Anyone under 45 is okay with just blood work. So that's a good question. Most patients make the mistake of trying to get in to see us too late, meaning too close to the time that they're looking to have a procedure done. We typically book up for surgeries at least 4, 6, sometimes 8 weeks in advance. So patients that I am seeing now this week, I may not be able to get into the OR for a couple of months. So I always tell patients, when you have the idea that you want to do this, when you're pretty certain that you want to meet with us, that's the time you need to call and get on our schedule. If you have a specific time frame for surgery that you're looking at, make sure you tell us that when you're on the phone with us or include it in an email. If we can accommodate you in for an earlier consult, we absolutely will. But it's good for us to know what your time frame is so that we can do whatever we can to make sure that that works. Yeah, we have hotels that we refer. In LA, they have wonderful aftercare centers that patients can choose to go to from the operating room, so that friends or family members don't have to worry about being a caretaker. There are great hotels all over, and we have connections in most of them. The best thing to do before you're coming in for a consult is really to have a clear idea of what you're wanting to achieve. Come in with realistic expectations. Come in thinking of what you want, but be open to different ways of getting there. A lot of what's online for this industry is geared towards women. And we made a decision about 7 years ago now to really focus on men. 98% of all of our patients currently are guys. There's not another doctor who can say that. So come in with an open mind, because you may be thinking about liposuction, or you may be thinking about one treatment because you read it online, but it may not be what's really best for you, and it may not be what's going to give you the shapes, the angles, and the lines that we like for men, which are sharper as opposed to round and curvy.
What's the best way to reach you?
Best way to reach me is go to one of our websites, maleplasticsurgerynewyork.com, maleplasticsurgeryla.com. Fill out a submission form. It'll come right to me, and then that's the best way, or pick up the phone and call us.